Good morning. Beautiful day in Albany. Good news today. Good news on the numbers. Good news on the facts. Today's day 108 since the coronavirus crisis started. For those of you who are counting, day 23 since the civil unrest of Mr. Floyd's, caused by Mr. Floyd's murder. So we have two different situations that are going on. We're handling both separately. There's obviously a convergence at one point. New York, we pride ourselves on being the progressive capital. Progressive capital means in action, right? Not just in words, not in rhetoric, but actually in results. I'm very excited about the New York State Police Reform and Reinvention Collaborative. What this will do is take all the concerns that are out there and have local governments sit down at the table, bring the police department in, bring the community members in, and design the police department that they want for their community. All the questions that you hear being raised, what should the police do? What are the right functions for the police? What should the budget be for the police? What should the staffing be for the police? What should the use of force policy be? Defund the police? How much is the appropriate amount for our communities to spend on police? These are all questions that you have to sit down and figure out and decide together. That's why the word collaborative. Why does this have to be done? It has to be done because the relationship is frayed, right? All these protests, what does that say? It says the relationship is frayed. Well, it shouldn't be, but it is. You know, this is a relationship between the police and the community. And when one party to a relationship says the relationship isn't working, then it's not working. By definition, it's not working. When one party says it doesn't work, it doesn't work. It doesn't help to say, well, I don't know why you say the relationship isn't working. I don't know why you say there's no trust, there's no respect in the relationship. If one party to the relationship says it doesn't work, then it doesn't work. That's life. The relationship between the police and the community isn't working. Why? Because the community says it isn't working. A lot of the police say it's not working. But it is about respect, and it is about trust, and that has to be restored. And it's not going to be restored until everyone comes to the table and decides a way forward. There is no one-size-fits-all. I'm not going to tell local police departments across the state we have 500. I'm not going to tell 500 local communities what they should do, but they should do whatever they need to do to restore that relationship and have a police department that the community supports. Otherwise, it's not going to work. That is the real work of reform, right? Protest, we're unhappy, I'm articulating it, I'm expressing it. Second step is action, is change, and addressing those concerns. And that has to be done. We set a deadline for it in New York. It has to be done by April 1. So there are 289 days and counting for communities to go through that process. Reverend Sharpton talked about demonstration, legislation, reconciliation. Demonstration, legislation is making the change, and then reconciliation. We have 289 days to do the legislation on a local level, and once you have the legislation and you have a relationship that works for both parties, then you can have reconciliation. But this has to be done, and it has to be done community by community. And this is the hard work of leadership in government. Put everyone at the table, figure it out. On the reopening, New York's path forward is dictated by the facts. We said that from day one. There's no political theory here. We're dealing with the virus. The virus doesn't understand Democratic politics, Republican politics. It's a virus. It's a public health issue. It deals with facts, and that's what we've been using to decide what we do from day to day. The facts in New York are very, very good, and I am so proud of what the people in this state have done. At this point, with the phased reopenings, we look at the testing on a daily basis because we're making decisions on a daily basis. And you see the past 5 days. New York City was 1.2 yesterday. When we started opening New York City, 1.5, 1.7, 1.4, 1.3, 1.2. So the number hasn't gone up. If anything, it's relatively constant. You're going to see those little ups and downs. That's basically true all across the board. You see little fluctuations, but nothing concerning. We have the lowest number of hospitalizations since we started. Amen. And we have the lowest number of deaths since we started. Once again, same numbers yesterday, but on the 3-day average, we are at a new low. And you want to talk about congratulations and something to celebrate. That is something to celebrate. And we're basically at a number that is so low that it may even be statistically questionable, because when you get down to 24, you're talking about literally how doctors decide a cause of death in some situations that may have multiple reasons behind it. So we went up the mountain, we came down the mountain. That is the configuration of the mountain that we climbed together, the highest mountain. And we did it with a smart reopening. We have done over 3 million tests now in the state of New York. More tests than any other state, more tests than any country per capita. We do 2 types of tests. We do diagnostic tests, which are you positive or negative today? And we do antibody tests, which are, have you had the virus at any point? We just did another sample on antibody tests, 12,000 test sample, which is a very large sample, right, all across the state, to find out where we've been. 12,000 starting 5/1 to 6/13. So about 6 weeks, we did 12,000 samples to see where we are today versus where we were 6 weeks ago. Overall, the number in the state has gone up about a point. Positive, last time we did the survey, was 12.3 statewide. It's now 13.4. So statewide, we've gone up a point. New York City has gone up about 1.6%. Long Island has gone up 2.7%. Hudson Valley, basically flat. Mohawk Valley has gone up 2.8%. Western New York down 2.8%. These numbers are telling and are significant because we watch the numbers. We watch the numbers on a day-to-day basis, but we watch them geographically also. And these are numbers that local communities should pay heed to. New York City, it's not good to see the number going up, but it's manageable. Long Island, we have to watch. Mohawk Valley, we have to watch. And congratulations, Western New York, and the other areas that actually declined. When you look at the increases by race, you see the African American number is higher, Latino numbers higher, and that's something we've been talking about. You further snapshot New York City, you can see the same basic factors and patterns in the numbers borough by borough. Bronx is up, Staten Island is down, Brooklyn is up a little bit, Queens is up a little bit. With these numbers, again, the numbers look very good. Statewide, they look very good for the regions, some areas better than others, but there's always been a variance from region to region. We're going to allow hospitals to accept visitors at their discretion. This was always a balance of public health versus the personal relationships and people who are in hospitals who desperately want to see loved ones and loved ones who want to see people in hospitals. But we're going to allow hospitals to start accepting visitors at their discretion pursuant to state guidelines that have limited visits, PPE, temperature checks, et cetera. Obviously, we need to be careful, but we'll allow visitors in hospitals. Same thing with group homes. This Friday, the group homes can allow visitors. It is up to the discretion of the group home. They have to tell the state if they're allowing visitors. And again, they have to follow state guidelines, masks, et cetera. We've reviewed the capital region data, and we're going to go to phase 3 tomorrow in the capital region, so we're excited about that. We're excited about the U.S. Open is going to be held in Queens, August 31st to September 13th. It will be held without fans, but we can watch it on TV, and I'll take that. The tennis authority is going to be taking extraordinary precautions, but that's going to occur in Queens. Again, it will be televised, but no fans there. There were two theories on the reopening when we started, and they were just theories, and nobody knew. One theory was we should reopen immediately. This was all overstated. There was nothing to worry about. Just reopen and reopen now. That was a theory. And there were political overtones to the theory, right? And there was a second theory which said you can't reopen right away. You'll increase the spread of the virus. You should phase the reopening, and you should follow the data and the facts on the spread of the virus on reopening. Those were two very different theories. And we had political debates about those two theories. And we had competing demonstrations right here in front of the Capitol. And there'd be one group that said reopen, and you guys would ask questions. Well, they say reopen. Why don't you reopen? Don't you think they're right? And the next day, the other group would come. Don't reopen immediately. Have a phased reopening. And then you'd say, well, why don't you do a phased reopening? Aren't they right? But they were two very different theories. And different states did different things, and different elected officials took different postures and argued two different postures. I said, I think the phased reopening makes more sense. That was my position. And I said it wasn't a political theory. It was a science-based theory because we're dealing with a virus. But we had a political debate. Nobody knew who was right. Nobody knew who was wrong. Well, now you know. Why? Because you tested the theory. You went into a laboratory and you tested it. And some places opened with very little control. And some places opened on a phased reopening that was driven by the data, right? So now we actually know what happened. Now we don't have to say, well, maybe, maybe, maybe. Now you can just look at the numbers. And the numbers say, the results say, that it has been better for public health and better for the economy when you have a phased reopening and you follow the metrics. As we sit here today, 21 states are seeing an increase. As we sit here. Why? They reopened quickly. They did not have the same phases. They did not have the same controls. They're seeing the number of cases go up. That is a fact. It is a fact. What then happens is there are articles about the virus is increasing, the cases are increasing, that destabilizes the market. And then the market actually responds in the negative. And that actually hurts the economy, right? From a public health point of view, the number of projected deaths because of these reopenings and the spike in the virus have increased dramatically. The projections by these scientific groups, they change the projections based on the spread of the virus. So ask yourself, how much have the projections changed since they have the data on the virus spreading? IHME, which is the Washington-based model, Gates-funded model, which is the model that the White House apparently follows, deaths by August. In April 17th, they projected 60,000. April 29th, 72,000. June 15th, they project 149,000. That's roughly 90,000 more deaths. 90,000 more deaths. Why? Because the spread of the virus has increased. That's the public health consequence. Why did their projection go from 60 to 149,000? Because the spread of the virus increased. Those are not Democratic numbers. Those are not Republican numbers. Those are just numbers, my friends. And we're not talking about 1,000 deaths. We're not talking about 2,000 deaths. We're talking about tens of thousands of deaths by that projection. Last week, they projected 169,000 deaths by October. Last week. This week, 201,000 deaths. In 1 week, they went up 30,000 deaths. In 1 week. Based on what? Based on the increase in the virus's transmission. That's why the phased reopening was always smarter. And New York State, from a website that is run by the founders of Instagram, they study the rate of transmission of the virus. We had the highest rate of transmission. Today, New York State has the lowest rate of transmission of any state. These are not theories anymore. These are just undeniable facts. You tested the theory. You now have results. Anyone can say anything. I can sit here and say, I have blonde hair, blue eyes, and a tiny button nose. I can say that. But then I run into a problem, which are the obvious facts that defy what I'm saying. Well, he said he has blonde hair, blue eyes, and a tiny little button nose. Yes, except I'm looking at him and he doesn't. Well, I know, but the governor said he had blonde hair, blue eyes, and a tiny button nose. Now, you can say, governor says he has blonde hair, blue eyes, and tiny button nose. I would say you might want to add a line that says, however, he doesn't, right? So you can have a theory, but then you have facts, and these are facts. So what does it tell us in New York? Stay the course. We were right. We have the lowest rate of transmission. The phased reopening is working. Stay the course. Stay the course means you have to stay smart, and you have to stay responsible, and we all have to stay responsible. We're going to phase 3 in the capital region. Employers, be smart. Store owners, be smart. Employees, be smart. Individuals, be smart. Local governments, be smart and do your job. And to everyone, stay smart, because smart works. Smart normally works in life, by the way. But smart works as a collective, and smart works for society, and smart works for New York. Wear a mask. And be New York tough, smart, united, disciplined, and most of all, loving.
Governor, how can people be sure that the information that they share with contact tracing is going to be protected? There's privacy concerns, as well as some people who are worried that their information is going to be shared with